Today on AI News, new AI model helps decipher, date, and locate ancient inscriptions. An AI system identifies problem gambling patterns. Computer vision detects early signs of lung cancer to save lives and treatment expenses. Nvidia invests 10 million US dollars in sidewalk robot delivery company Serve Robotics. As AI industry faces collapse after international sanctions, and Ford patents a brain-machine interface system to drive a vehicle with your mind. An AI model created by Alphabet subsidiary Deepmind helps not only restore text that is missing from ancient Greek inscriptions, but also suggestions for when the text was written within a 30-year period and its possible geographic origins. The new software, named Ithaca, is trained on a dataset of some 78,608 ancient Greek inscriptions, each of which is labeled with metadata describing where and when it was written, to the best of the historian's knowledge, to suggest text, date, and origins. It is 62% accurate when restoring letters and damaged texts. It can attribute an inscription's geographic origins to one of 84 regions of the ancient world with 71% accuracy, and can date a text within, on average, 30 years of its known year of writing. Ithaca is not capable of operating independently of human expertise. Ithaca was designed as a complementary tool to aid historians. AI that can help casinos cut down on problem gambling. You may ask yourself, isn't a problem gambler exactly what a casino wants financially? But gambling operators can be fined or lose their licenses if they fail to monitor problem gambling and act when necessary. Mindway AI, a company that grew out of RS University, predicts future problem gambling. The company uses psychologists to train AI algorithms in identifying behaviors associated with problem gambling. Mindway's system takes into account 14 different risks, including money and time, but also canceled bank withdrawals, shifts in the time of day the player is playing, and erratic changes in wagers. The AI then builds out a risk assessment of each player, improving itself with each hand of poker or spin of the roulette wheel. Players are scored from green if you're doing fine, to blood red, which means to immediately step away from the game. They assess each client's customers and use that model as a sort of baseline. The algorithm then replicates its diagnosis to the full customer database. As soon as a player profile or player behavior goes from green to yellow and to the other steps as well, they're able to do something about it. The value in the program isn't necessarily just identifying those blood red problem gamblers. With Mindway, they can identify the players before they ever reach that point. How to actually communicate that information and what to tell the gambler is still an ongoing debate. Mindway's technology lives mostly in online gambling. It analyzes not only individual risks, but total risks for the system. And the application of such a tool may be better used personally instead of broadly, such as when you receive online banking pop-up notifications of your spending. Computer vision detects early signs of lung cancer to save lives and treatment expenses. AI has become key when tackling cancer. The Task Force for Lung Health estimated that 20% of lung disease patients waited for more than a year to receive prognosis. Lung cancer is the most common type of cancer across the globe. Its aggressive nature and absence of early, visible signs often leads to diagnostic and treatment delays and poor outcomes. Early diagnosis of the disease greatly increases the odds of survival and allows for the adoption of less invasive medication and intervention. However, early identification of lung cancer is difficult because cancer screening through conventional methods is a costly procedure. Physicians' workloads make it difficult to conduct a thorough examination. Screening for cancer nodules in routine examinations is tedious and error-prone, and lung nodule screening is not a part of the healthcare protocol at present. AI can detect malignant lesions. It can help clinicians with the issues of healthcare interoperability, such as misdiagnosis, analysis, reporting, detection of co-findings, and reduced time constraints. Once a patient is hospitalized, the AI can help to follow up on the scans and help to track lesions over time. It can generate a score to assess the risk of nodules being cancerous, which can be done for different types of lung cancer. The technology has also been designed to be explainable and modifiable AI. That means the decision-making process is intelligible. The AI points out what is observed with annotations, which is then integrated into the reporting workflow. The decision to use the observations or edit it lies with the radiologist or clinician who is responsible for taking the next steps in the pathway. Nvidia invests 10 million US dollars in sidewalk robot delivery company Serve Robotics. Serve robots, which the startup says are capable of operating in specific geofenced areas without a remote operator for safety, currently rely on Nvidia's Jetson Edge AI platform, the hardware or compute module that sits inside the robot and powers autonomous movement. The startup also plans to use Nvidia's perception and mapping tools, which will help its robots understand where they are in the real-world environment and where they need to go. Serve tests its modules in simulation. For that, Nvidia offers synthetic data generation tools for training perception models. Offerings such as these come under a suite of tools from Nvidia, dubbed Isaac, that provide robotics developers with a range of software technologies from simulation to robotic fleet management. Companies like Coco and Tortoise have leveraged remote operators to drive robots to their destinations, giving them a quicker and easier path to market than aiming for full autonomy. The sidewalk is more chaotic than the street, says Kashani. We have even interacted with goats. The randomness of what you see on the sidewalk is an order of magnitude higher than on the street. Delivery hero backed DX Ventures, 7-Eleven's corporate VC arm 7 Ventures, and Uber will be tapping Serve as a delivery service partner for Uber Eats. Russia's AI industry faces collapse with international sanctions. New technology sanctions, an exodus of foreign tech companies, and an impending brain drain could soon conspire to cause Russia's AI ecosystem to shrivel. Russia has long been a major global player in the development and application of machine learning and other AI tools, including unmanned military systems, facial recognition, natural language processing, and smart city technologies. Russia's AI efforts were already tottering. Collaborations between Russian AI researchers and scientists in Europe and the United States have been in decline since 2014. Cutting-edge AI research benefits greatly from cutting-edge hardware, and experts believe the sanctions imposed by the United States and its allies on advanced microchips will eventually shrink the capabilities of Russian researchers to develop new machine learning techniques. Even without sanctions, Russian AI research is at risk of being cut off from crucial chip supplies because of the recent decision by Nvidia to suspend all product sales to Russia. The broader exodus of tech firms from Russia will leave any company pursuing advanced AI research high and dry when it comes to financing. Crushing sanctions and tightening authoritarianism are likely to lead Russian mathematicians and programmers to emigrate in the coming weeks and months. The opportunities are going outside of Russia. And finally, Ford patents a system to drive a vehicle with your brain. Ford has filed a patent application with the United States Patent and Trademark Office for what the automaker calls a brain-machine interface that can anticipate steering, acceleration, and brake inputs. It would look for brainwaves that indicate a muscle movement is imminent, allowing the system to predict that the driver is planning to turn the steering wheel, for instance. This information would then be fed into the car's driver assist systems, which would then make adjustments accordingly. Basically, it would just complement what the human driver is already doing. The brain-machine interface would connect to the sensors and vehicle control units most new cars already use in their driver aids. Perhaps a brain-machine interface could help enhance driver assist systems like Ford's Blue Cruise, helping to bring the tech's response more in line with what the driver is expecting.